Hi there. Here we are with our patient Johann. Johann flew over 20 hours from an island called Malta out in Eastern Europe. Is that correct? It's in Eastern Europe? I'm embarrassed to say I did not even know where Malta was. I had to ask my dad last night, so I apologize about that. Anyways, our patient took this long journey. He's had a couple previous procedures. He happens to be a class 6 with a hereditary familial family loss of hair, and he's had 2 previous FUE procedures. For those patients who are seeking hair transplants, an FUE is a follicular unit extraction. It's the process where they're taking out individual follicular units, unit by unit, and they're calling it a scarless procedure. First of all, there's no such thing as a scarless procedure. Anytime somebody invasively touches the skin with an instrument or any type of surgical tool, it's going to leave a scar, period. So let's start there that a scarless procedure doesn't exist, period, if there's any invasiveness whatsoever. Now, when you do a follicular unit extraction, instead of leaving a linear scar when we harvest the donor hair, they're leaving multiple scars from where they take a punch biopsy instrument or an Urtis, which is a new robotic machine to harvest or extract the donor hairs. I want to show you up close what that looks like and show you how that compares to a linear scar, and then I want to show you the difference in results. This patient had 2 procedures, keep in mind. Each procedure yielded a probably in the neighborhood of about 1,000 to 1,500 hairs. So let's say with those 2 procedures, let's give him the benefit of the doubt. Let's say he moved 3,000 hairs, which I don't believe I'm seeing that out there, but let's just say he did. In one of our procedures, we minimum remove 6,000 hairs to give you an idea. So we give double what he got in 2 of his procedures in one of our procedures. Our patients who come to our office are very well educated because they've already been through similar situations as Johann, and they're here to correct them. So let's take a look at what's going on, and then we'll see if we can make sense out of this for you. So what they did for him is they recreated his hairline, and then they filled him in. I'm just going to turn down a little bit. And as you can see, this whole area didn't have hair. So what they did is they put hair here, and then they put hair on the crown, and they didn't even address the area in the center, which nobody naturally has anything like that. So right off the bat, that's not how we do things here, because we would only put something on our patients that naturally occurs in nature. That doesn't occur in nature, so we don't do that. So when you build in 2 different areas, if there's no hair in between, it won't look right. Basically today what's going to happen is we're just going to get as much hair as we possibly get from that donor area. We're going to restore the hairline so it looks more natural. We're going to bring the 2 areas together to blend it in. And I'll be able to do that all in one procedure. Alright, we just shaved our patient's donor area, and now we can take a close look at how a follicular unit extraction looks. And then I want to explain to you what's going on. So first of all, let's take a look at this together. If you look here, okay, you can see all these little white areas that are void of hair. That is where they took the instrument to get the donor hair. Now, I have a few instruments here just to show what's going on. What the industry will use is a instrument to do a punch. It's called a punch biopsy. And in the olden days, when they used to do plugs, they would use an instrument like this. It's a happens to be a 2mm punch. They actually did as big as 4mm punches. Okay, so just to get an idea, I'm not using this, so I'm not trying to be sterile or anything. So it just looks like a little pencil, okay? But inside the center of the pencil is the punch. So now this creates a little hole. So what they would do is they would take this and they would blindly punch into the skin to try to pull out that follicle one by one. So when they got that little piece out, then they take that same instrument, they punch a hole on the top of your head, they take that and plug it in. That's where we got the term plugs from the punch biopsies in the olden days. Let's fast forward to today. Now they have a new punch biopsy that could be now, instead of 2 millimeters, it could be 1 millimeter, a smaller punch, okay? And instead of calling it a plug, we're gonna go ahead and give it a new name and call it an FUE. So now we have a new name for our new procedure. So now imagine I take this little instrument here and I punch these holes out of the back of your head blindly. Do you think I'm gonna get good grafts for you? You're a smart consumer, right? You're watching my videos. How good are my hairs gonna be coming out of that tiny little thing blindly? It's a lot easier for a doctor to remove a strip than it is to punch little holes out blindly. Because we can see what we're doing when we remove the strip. Then that strip gets passed over to our nurses who use high magnification and are sitting right on top of it, and you can see the follicles. So there's no room for error. With follicular unit extraction, which is an old plug, full of errors. It's a proven, failed technology. Do you see anyone going to get old plugs? No. So why are we doing FUE? It's the same thing. The most punches they'll make is 1,000 in one session. If I pull out 1,000 follicular units, and let's say they're all perfect, and let's say I get 2 hairs in each one of them, that's 2,000 hairs, right? 1,000 hairs here. That's the best you're going to get. So the best you're going to get 2,000 hairs. When I do a strip surgery, okay, and I pull out an area like this, all the way around, okay, 34 square centimeters, okay, and those average 200 hairs per square centimeter, it yields you over 6,500 hairs. So 2,000 hairs, best case scenario, 6,500 hairs. So they charge you more to give you less, to put you on a treadmill so they can make more money off of you. So it's not your fault, it's the industry's fault for selling an antiquated procedure that's inferior to the strip technology. And if anyone wants to tell me differently, contact me. So basically when you leave here today, this area I'm about to show you, you're not going to be able to see because the hair is going to cover up on top, okay? But I want you to see what I'm doing is I'm going to have this area shaved. I'm going to take you as far as I can go from the one side. I'm going to take you all the way around like this, completely. So this whole area you're seeing will be on the top of your head, okay? And I'm going to take it all the way around like this and continue to go as far as I possibly can go. I'm going to get anything and everything I can get out of that donor area for you today. Because of the way they did the follicular unit extraction, it does affect the total number of hairs. So you do have good density, so that helps to make up for it. But instead of getting 6,500 hairs, it's probably going to cost at least 1,000 hairs from what they did. So it's probably going to be in the neighborhood of about 5,000 hairs. But it's still a monster improvement, and there's nothing I can do. It's just unfortunate the way they harvested it in the past. So it is what it is. I'll get you the maximum capacity we can get you at, and then we're going to address it. Okay? Now, if it's okay with you, I would just want to trim and shave this area. Thank you very much. Thank you very much. My patient, for potential patients out there, I always prefer if the patient allows me to shave the donor area. Not only because it makes my job easier, which it does, but that doesn't matter. It makes it easier for the patient to take care of it after the procedure. The reason we want a clear field to work in is because we're not thinking short term with you, we're thinking about the rest of your life. As much as we are concerned about your next 4 months, we're more concerned about your next 40 years. So we don't want to take a chance on a non-permanent hair affecting a hair that we're going to move that's going to be permanent. So if you don't mind, we prefer to have a clear area to work in. So this is a patient that agreed to that. It's not required. We do not have to shave your head. However, we would prefer it. I just want the camera to take a close look at the little follicular extraction spots. Can you see that everywhere there's a little white area void of hair? Those are where they took a punch biopsy and got a follicular unit out of that. And so those are now void of hair. I was showing you earlier that we have multiple sizes of these different types of punches. So they punch out based on what they're trying to get, but usually they'll use nowadays about a 1 millimeter punch. So just to give you an idea what that looks like, just to kind of refresh your memory. So in the olden days, when they did the punch biopsy, they would just take a little punch with a bigger punch biopsy, punch a hole on the top. They would take that area that was punched out, plug it in. That's where we got that term plugs from. So fast forward today, we now use a smaller punch. We give it a new terminology called FUE, and we're reselling it to the public, to you, the consumer. So we're taking an antiquated procedure, giving it a new name, and then we're selling that to you. That's what the hair transplant industry has done. So now they sell it with a machine. Now they sell it with new names called grafts. There's all sorts of different ways to rename this old technology, which is outdated and inferior to the strip technology. So if I were to take this instrument and punch a hole, how accurate do you think I would be pulling a hair out? What do you think? Do you think I'd be more accurate taking a strip? Do you think I'd be more accurate blindly trying to punch a hole out? You make that decision for yourself. What we're going to do now is we're going to harvest the donor, and then we're going to show you how that looks when it comes out, and we'll go from there. Okay, so when they do the follicular extraction process, it can take upwards to about 6 to 8 hours to harvest the donor. So 6 to 8 hours, now you're going to see how long it takes me to harvest 4 times the amount of donor that they get in one follicular extraction procedure. And that's going to happen now. So right now I'm looking at the clock. If Josh, you want to put the clock on the clock. It's right now 5:15 our time. And I'm now beginning this procedure of the extraction of the donor. Right now I've already completed the extraction process. What time is that clock say? So it hasn't even been 5 minutes and I've pulled out over 6,000 hairs under a very controlled circumstance. Now I'm going to suture this back together. That shouldn't take me more than another 10 minutes, and that's it, the whole thing's done. Okay, I just got through harvesting Johann's donor hair, going through his previous follicular unit extraction. And I wanted you to take a look at the donor hair, how the strips look, and get a feel for what we're doing versus what they're doing. Now, one of the things for my patients who have been following along is that we're very concerned about transection. Transection is when a follicle is cut in the harvesting process, which is meaning we're destroying the hair when we're taking it out, okay? So what we're looking to see is if there's any transections of the follicles. So this is the bulb of the follicle, the black dot, for my patients who have been following along, or viewers. That's the hair itself, okay? So we want to see if anything's cut. So when we take a look at this, you can see everything is nice and intact, and that none of the follicles are cut from top to bottom. So this is the bottom of the follicle where the bulb is. That's the top where it comes out. As you can see, everything is nice and intact. This would be considered transection over here, where these hairs are cut. So those are transected hairs. But for the most part, you can see that's a very good clean strip with virtually no transection. If you take a look at the bottom one, same thing, very, very minimal transection. Now I don't even see any in this one, the whole way. And that's a little transection right there. That's a little transection right there. But for the most part, another perfect strip. Now, I took these strips out literally in 5 minutes or less. I yielded my patient well over 5,000 hairs. The reason I only have 5,000 hairs is because of the follicular extraction surgery, because it affected how much hair I got. But still, in under 5 minutes, I pulled out, let's say, over 5,000 hairs. That's almost triple what he's had
and his 2 previous surgeries with the follicular unit extraction procedure. He'll tell you himself he spent 6 hours just to harvest the donor. So for what? So you're sitting in a chair for 6 hours to get 1,000 hairs for what, and paying more money for what? So for a scarless procedure, which I showed you, was more of a scar than what you see in my videos. So be a smart consumer, figure out what makes the most sense for you, and ask the right questions to your doctor. I'm not saying I'm going to be everyone's doctor, but make the right decision for yourself, because I'm doing more corrective surgeries on follicular unit extraction cases than anything else right now. The majority of the work I do here in this office in the United States is corrective surgery. My patients fly in from all over the world to have me correct these previous types of surgeries. So do your homework. Don't be put in the same situation as this particular patient. Do the proper research and make the proper decision.